Uh, let's join for the second lecture for electronic medical records. I hope you're doing well, and I trust everything is fine. Yeah. So in our first lesson or the lecture one, we were talking about the general electronic records. Okay. Yeah. So right here we want to understands the actual electronic medical records, the realities in the specifications of electronics medical records. We have varieties of electronic records. In the general records, we have electronic records, and that is the introduction that we had at the beginning. But right now, we want to specify and specialize on our area of medical records. All right, so you can grab a cup of tea or a coffee, wherever it is, or water. Water may be very healthy, and then you sit close to your learning lesson at this moment. Okay, so like we said before in our first lecture or lecture one, an electronic medical records, we define it as a digital version of a patient's paper charts. Okay, it is a kind of a real-time patient-centered records that make information is available and instantly, securely to authorized users. So electronic medical record basically is very effective, and it is centered on the patients, and it is more efficient, which is purposely made to ensure that a patient's information are always available and they are instantly accessed and they are secured wherever they are kept in different digital medias that can be used. So, while an electronic health records does contains medical and treatment histories of patients, an electronic health record systems is built to go beyond the standard clinical data collections in a provider's office. Sorry about that pop-up. I don't know. Yeah, so not only talking about the storage of the informations and patient-centered and timely accessibility and the provisions of the information, but also electronic medical records goes beyond consisting of the patient medical history and treatments. It goes beyond that. It is built in a way that it can provide services to different offices, clinical offices at the same time, and can be inclusive of the broader view of a patient's care. And electronic health records are a vital part of health information technology and also can, number one, contains a patient's medical history. Okay, sorry about that. So electronic uh, health records are a vital part of ICT. Okay, and it contains, number one, patient's medical history. It is consists of patient's medical history and diagnosis, medications, treatment plans, immunization dates, allergies, radiology images, laboratory and test results. So in other words, you can also be able to say to really put it after you printed your work here, you can say here as elements, okay, elements of EHR, right? You can actually call that way so that if we ask or if you're looking for the elements or components of electronic health records. You can talk about this, but down there, as we move on, I've talked about those elements into details. So, what does electronic health records contain? It should contains or it contains a medical list of the patients. It contains the diagnosis, contains medications, contains treatment plans, contains immunization dates, allergies, radiology images, laboratory and test results. And number two, allow access to evidence-based tools that providers can use to make decisions about the patient's care and and automate and streamline provider workflow. What I mean by that is ensuring that the work of the service provider becomes easier for them. You know, before people could be moving up and down trying to submit medical forms from one doctor to another, but using electronic health records, the information can be shared at the same time, and two different people, even more than two different health service providers, can be using the same information at the same time for different purposes. So one of the key features of electronic health records is that health information can be created and managed by authorized providers in a digital format, capable of being shared with other providers across more than one healthcare organizations. So it is a very good a key feature of electronic health records. Like I've said before, it can allow people to share the information at the same time. It can allow you to create a digital records as traced to the system without using paper-based records, and then you can be able to share it to different people within the organization or maybe across the organizations. You can be able to share the same information from Kampala to Kapsora. You can be able to share the same information across districts in the nations. So that is the key feature of electronic health records. And they are also built with intentions of allowing sharing of this information so that healthcare service providers can be able to access them from wherever they are. So things like laboratories, specialties, medical imaging facilities, pharmacies, emergency facilities, and school and workplace clinics. So they contain from all clinicians involved in the patient's care. So it becomes very easy. It is actually very easy. The technology has made electronic medical records very, very, very easy. All right. And we want to look at the EMR. What does people say about EMR, EHR? What does people think? I mean, so most of the service providers, they assume or they understand that putting in place electronic health records, it is an ongoing journey. It is it is a long-term projects. So it is always good to understand that there is no single destinations or ends, as there is always the opportunity to optimize the workflows or even improve the use of data. And of course, the sections provides resources to guide you through many stop along the road to electronic health records adaptations or adoptions, implementations, and improvement as well. So this includes planning, selecting a vendor, constructing with a vendor, implementing and adapting an electronic health records, using your electronic health records, and also optimizing or replacing your electronic medical records. So this is basically the areas that are specialized or meant for people that are planning to put electronic medical records in place. So they need to first of all do the planning, and if the planning is being done, the selection of the vendor here is the person who is going to emphasize on the development of the software or the systems at the end of the day. All right, then you can be able to agree on what is going to be included, the contents, and what is going to cost. Then after that, the implementation can start. And also you, the service provider or the facilities, what is expected of you is adapting to electronic medical records or health records. And also you can start using, and then you'll be able to optimize or put everything that you would like to use in your system. And you can be able to share your electronic your informations throughout the facilities, or maybe across the country or nations. All right, so now let's look at the benefits, the brief benefits of electronic medical records. Okay, number one, sorry about this. This is a repeated lesson, and of course, you'll be able to ignore that. Okay, it's a repeated information. So this is this should be our, how does health information exchange affect your practice? Okay, how does it affect your practice? So uh, for many time, there has been a lot of challenges that was facilities has been facing, and different administrations who are in the front line of service provisions have been facing for many years. All right, but after the introductions of electronic medical records, where the exchange of the information is easier, and the sharing of the information is very easier, the offices and different hospitals, as they've actually tremendously gains a lot in the introductions or implementations of electronic medical records, which tentatively shift using of paper-based records to electronic format, which is very much more effective in ensuring that the quality of the services provided are actually effective in the facilities. So, because we all know very well that information of the patients is expected to be safe in terms of the security, the privacy, in the terms of preservations, of course. So basically, the electronic medical records becomes the best options, which can facilitate the electronic exchange of the health informations that have been a very big trouble to the healthcare systems. And also, the challenges has been in relation to this, that most of the patients cannot be able to move all around with their medical records. So it is okay if at all the patients move without their records physically or personal health records, and still the information can be accessed and shared from wherever they are and anywhere they are going. So appropriate and timely sharing of patient information also allows clinicians to ensure patients receive timely care in most appropriate settings by, first of all, reducing duplicate testings. Definitely, the rates of the duplicate testing is has dropped due to the implementations of electronic medical records, and as well avoiding medications errors. We understand that the reasons for the establishment of electronic or maybe medical records is basically to helps in reductions of medication error, which has been so rampant and has affected the health of varieties of the people, because the facilities or the clinicians or service providers, they cannot be able to remember everything that they have done to each and every patient. So the availability of electronic medical records or the availability of medical records ensures that the informations are easily accessed and they are always available. And we also have avoiding readmissions. So the readmissions we are talking about here is not necessarily the patients who comes back to the facility for the same problem, or maybe for different problems, but this is focusing mainly on the duplications of the medical records, numbers, and other things, which can be basically be improved through the use of electronic medical records. And then also it has improved a lot in decision making, by the way. And finally, enhancing care coordinations. Has played a very big role in ensuring that decision making by the stakeholders and the service providers has always been effective. Why? Because the rates of error or the level of mistakes when using paper-based record has been reduced to 94%, which is much more effective. So let's look at the difference between electronic medical records and personal health records. Okay, there is something that is called personal health records. Yeah, so an electronic medical records is a digital version of a paper-based charts in a doctor's office. They contain primarily the notes and information collected by and for the clinicians in that office. And electronic health records is built to share information with other healthcare providers, such as laboratories and specialties. Now, the difference between the electronic medical records and electronic health records is very simple. Electronic medical records is just a simple digital versions of patients' information, which is kept in a medical office or a clinician's office. Okay, but electronic health records, it is purposely built with intentions of allowing sharing of information across different offices of the patients. Now, if you are getting confused, you can be able to struck these personal health records with electronic health records. The difference between health and medical, okay? So the medical is that electronic or digital versions paper-based record which are kept or maybe they are there in the doctor's office. Okay, they are just electronic, they are just in the digital formats, but those are the patient's information. All right, so an electronic health records, like I said, is purposely built with intentions of allowing sharing of informations. And a patient's health records or electronic health records contains the same types of information as electronic health records anyway. Diagnosis, medications, medication, family medical history, the contacts information for providers, and it's also designed to be set up and accessed by the patient themselves. All right, so let's be able to move forward. And then we talked about advantages of electronic health records. What are the advantages, people? Um, I'll wait for complaints over this, to be honest with you. If you need an explanation, that is when I will talk about this. I made these notes very simple, very, very simple. Can you read this? Can you actually read the advantages of electronic health records yourself? Please. And then you can be able to, if you don't understand anything, I can explain. Okay? You can come back and then I can explain. All right. So the advantages, I also have the main advantages and our advantages, which is here. And I'm expecting questions, especially questions concerning the difference between electronic medical records and electronic health records or personal health records. Okay. All right. So here, these are the basics of electronic medical records. That is what electronic health record must contain. Okay, and what we're talking about is electronic health records. It's not actually even electronic medical records. So we have even the differences between electronic medical records and electronic health records. EMR versus EHR. Okay, is very, very easy for you to look through. And I want you to look through that. With all the knowledge that we have been gathering, with everything that you've studied, this becomes a very, very simple things to read by yourself. Basically, with the help of the records identifications and filings. Yeah, so the only thing, like I said, is that the management of the informations are done electronically. Okay, so when you look through, you understand that it's actually a very simple thing that it's just a matter of taking notes, I mean, or summarizing them. And thank God that I was summarized them already for you. So do that, and then if you have any questions, drop it down there at our platform, and then I'm going to talk about them one by one if you have any questions. Otherwise, thank you for that.